Welcome to Home Health 360, a podcast presented by AlayaCare. I'm your host, Jeff Howell, and this is the show about learning from the best in home health care from around the globe. Thanks again for joining another episode of Home Health 360, where we talk with home health leaders from across the globe. Today we have Lenita Kanoke. Did I get that right? Kanoke. Kanoke. I promised. I even wrote it down. Okay, so we're off to a great start. Sorry, Lenita. She is the VP of Clinical Excellence with over 30 years experience in medical management, including utilization management, case management, disease management, quality assurance, and call center operations. And she's at Right at Home. She used to serve as the president of the American Association for Managed Care Nurses and is currently a board member. And she joined the Omaha, Nebraska headquarters of Right at Home in August of last year as the VP of Clinical Excellence. Lenita, welcome to the podcast.
Thank you, Jeff. I'm thrilled to be here.
And we also have Nikki Hollies, who joined Right at Home as VP of HR in December of 2019. In her role, Nikki focuses on corporate human resources, HR for Right at Home corporately owned locations, and the employee experience system wide. Nikki brings more than 20 years of experience transforming HR departments into strategic business partners within the organization. Nikki, thanks for being here today.
Yeah, thank you. Sounds so old when you say 20 years. My goodness.
Well, I heard a great saying: the days are short and the years are long and the days are short.
Yes.
No. Did I get that? No, the days are. Well, I'm really off to a bad start here because now I'm even getting my normal colloquialisms mixed up. But I do have to bring up that a few years ago I visited Omaha. And the bus that we were on, I think it was headed to a brewery, and it, of course, drove by Warren Buffett's house. And everyone was surprised that his home was smaller than what I thought the guest home might be. So I'm sure you get people say that to you all the time, anyone who's visited Omaha.
Yeah, he's got a modest abode here. That is true. But he's definitely the icon of Omaha. That's how we refer to him.
Well, Nikki, since you've been at Right at Home a little bit longer, I did some research. I noticed you guys are in 7 different countries. I thought that might be the highest global count of a franchise. I know you have over 60 locations in the UK. You guys are in Canada, Australia, China, Ireland, the Netherlands, Japan. Can you give us a sense of what the global entity looks like?
Yeah, absolutely. I'm happy to. So lots of folks may not be familiar with the franchise business model. And really what it comes down to is, we have presence here in the United States, obviously, and then our brand is in the 7 different countries that you just referenced. And as such, our brand is awarded by awarding what we call IMLs, or International Master Licensees. And these IMLs in their respective countries are responsible for providing the support and the best practices and the resources that any franchisor here in the United States or overseas would provide to the franchisees that they then award within their countries. And so, lots of work that is, I don't want to say duplicated, but is mirrored on how we work here in the United States. Lenita and I being at the corporate office here in Omaha, Nebraska, and providing support to the over 500 locations that we have here in the United States, works very similarly globally. So our international master licensees in the UK, Ireland, Netherlands, they will provide those same level of support to the franchisees that they're awarding in their countries. So lots of great work across the brand for Right at Home that is happening globally. And we're excited about continuing to grow those opportunities and expand into other countries as well.
And I think I saw you guys are over 600 territories right now. Can you give us a sense as to saturation levels in different countries, or many territories that might still be open?
Yeah, absolutely. So I don't have any of the specific numbers in terms of number of territories within each country.
Hmm.
That being said, I can tell you that they account for the international system comprises about 30% of our overall global footprint.
Okay.
And accounts for about 20% of our right at home system revenue. So that gives you just a little bit of backdrop there on our brand as a global brand. That being said, the pandemic, of course, put a damper on the growth for a lot of businesses. We were not immune to that. There was a period of time there, especially through 2020, where we saw a drop in revenue, drop in hours, not only here stateside, but also globally. That being said, we're really proud of the fact that every single one of our countries has rebounded and continues to see growth. And we see growth not only here in the United States, but across all 7 countries that we're in outside of the United States.
Was that just kind of a slow climb back to normal? And the second question I have is this narrative around folks that say, well, COVID hits, the demand for care in the home actually went up because we want to pull out all of our seniors from care homes. What did you guys see?
Yeah, I think we absolutely saw that. It was one of those situations where folks that were living in long-term care facilities, skilled nursing facilities, they found themselves in a situation where they were separated from family. So family wasn't able to come visit. We saw those heartbreaking pictures of people visiting through windows. If somebody happened to be lucky enough to be on a ground level unit, that they were able to see some loved ones through their windows. But outside of that, it really brought to mind the importance and the significance of someone being able to age in their home and allow for them to have a bit more control over who came into their home and how they came into their home and the safety there which. So it's one of those situations where it really highlighted the importance of somebody being in an environment that was safe for them. But as as I think we all know, that definition of safe is going to be different depending on the person, and that recognition of family support or those who act like family support. So family is what we make it, right? So that's really what we saw. And so yes, we saw a decline in hours because for a while there they stopped working. People stopped having to go into the office, and therefore there was more time for loved ones to take care of their own loved ones as opposed to depending on maybe agency caregivers. But then as folks started to go back to work and as folks were able to get out of those long-term care settings and skilled nursing settings and go back into the home, the demand started to increase again. So then we saw that demand on the rise. And really now, the biggest governor on being able to provide care to clients across the globe is caregivers. So caregivers are in very, very high demand. That is, and I think we'll talk about that here in a little bit, but that's no different in the United States than it is in Ireland or the Netherlands or China or Japan. This is a pandemic in and of itself, or an epidemic in and of itself, is that caregiver shortage to really provide the care to the seniors that do want to stay in their homes as they age.
Sure. And Lenita, from a clinical perspective, so my understanding was that there was just this immediate need to relax the level of care because of the urgency of care. And, we saw things like Zoom calls were at least temporarily allowed in some places. What were some of the kind of things that you were seeing?
Yeah, I mean, there was creative thought processes into how do we continue care for people during the pandemic. Zoom calls, Facebook calls, things like that, I think were embraced by the industry. I would say that we put things in place to make sure we could safely care for the people in person as much as possible. We, use the CDC protocols. We put everything in place to really just keep people safe and be able to still continually care for them, because the majority of people really need us hands-on to help them. Working from a Zoom call is not going to really do a lot for someone who needs someone in there to support them.
Right.
So we did what we could to continue to support those that really needed us the most.
I will say to Lanita's credit, I think she's selling herself a little bit short, because at all times, Lanita has had a presence of mind to ensure that, yes, we know that we need to get in, we know that we need to provide care, but at all times, safety was paramount and continues to be paramount.
Absolutely.
For the clients and for the caregivers. And that really has been a very strong focus for Lanita and her group as we continue to provide support here in the United States and global, and saying this isn't just about the dollars. This is not just about the revenue or the hours that we're billing. This is about ensuring the safety and the well-being of both clients, their family members, and our caregivers.
Right.
Yeah, the caregivers had to run into the burning building, while no one knew what we were really dealing with. What would you describe as the sort of drop off, or like staffing is hard to deal with even in good times. So when the pandemic hit, what were you guys seeing from your workforce?
What we saw was a couple different things, I would say. The first thing is we have really dedicated caregivers. They do what they do because they love what they do. They care for our clients because they love our clients. So they did what they could to continue to care for our clients. Sometimes that puts us at a disadvantage, because obviously we want people to support our clients, but we also want them to be well at the same time. Mm-hmm. So I would say, even as an industry, the pandemic just changed our thought processes about how you go to work. Like, you need to come to work well, because we are taking care of very vulnerable people. But at the same time, it makes you appreciate how dedicated those caregivers are. We are no different than any other industry, though. There are other people that were, okay, I guess I'm sick, I'm not going to work, or I'm just not going to work anymore. And I mean, and all of that has impacted the caregiver shortage even more so, because now it's a little more scary for people to say, oh, do I really want to go into someone's home and care for them? What's the risk to me? What is my risk to them? So I think that as an industry, we're just going to have to continue to embrace the changes that this has brought to us, and work to keep our people, both caregivers and clients, safe and healthy.
Yeah, and it's a little bit of a, it's tough, I guess, is the word that I'm looking for. And there's no really way to sugarcoat that, because the pull is so strong to care for the clients, and the pull is so strong for the clients to want to have the familiar caregiver that they've been working with. And so there are times when it might feel attractive to say, okay, it's just a tickle in your throat. I'm sure it's nothing. I'm sure you're okay. This client really wants, you to come and take care of them. There's a pull to want to do that, because that's what the client wants, and maybe that's what the caregiver wants. But on the other side of that spectrum, there has to be a very healthy level of respect for the virus, and a healthy level of respect for the fact that this is a pandemic, and especially early on, not knowing what that meant, and not necessarily knowing how long it lives on surfaces, and how long, can it be spread through, just nose and mouth, or is there, other means of spread. And so there was a long time there that there was just a lot of uncertainty and fear and concern that was also being, levied with this desire to really provide care and receive care. And so there was a lot of there was a lot of things that had to be taken into consideration, and hindsight looking at it feels like it's been 10 years, but hindsight looking 18 months ago,
right.
There may be things that people probably thought was overkill or what have you, but when you're dealing with a vulnerable population and you're providing care that requires, a close human contact face to face, sometimes you got to take those extra precautions and really recognize where the risks are.
Mm-hmm. So you, Nikki, had just been in your role at Right at Home for a few months before COVID hit. I'm curious, that's probably just long enough to get your feet wet, and then this pandemic hits.
Yeah.
How did things change for you on, you weren't going to get out of here without talking about recruiting and retaining caregivers.
Yeah, right. I mean, this has been just an absolute roller coaster ride for so many reasons. And, coming aboard and really, having the opportunity to lead corporate HR and the opportunity to lead our employee experience initiative, which is our department who provides support to the franchisees in recruiting and retaining top caregivers across the United States. We had all sorts of plans for proactive strategies and maybe some different technology and some different things that we could do. And then you're right. And then all of a sudden, 2.5 months into my tenure, this global pandemic hits. Mm-hmm. And all of a sudden I went from being, I feel like, the VP of HR to kind of school nurse, right? And working with Lanita to really be able to provide franchisees with that support that says, okay, CDC guidelines, testing, what is an antigen test? What is a PCR test? What's an antibody test? What do they all mean? When can you test? When should you test? What are the symptoms? So all of those things are just, they're going, we were just going through so much. And then on the flip side of that, there's caregivers that are fearful to come to work, that are homeschooling children because schools across the United States have shut down. So now they're unable, even if they want to work, they're unable because they are now being teachers in their own homes. They're caring for their own loved ones. Maybe they have in their homes folks who are medically frail with immune diseases. And so they, for those reasons, can't go out into the world and risk bringing home an illness to their own family members. So we saw that pool of caregivers just overnight, absolutely overnight, just tank. It absolutely tanked. And so, we went from, okay, kind of status quo, and we're recruiting and we're retaining, to, oh my goodness, we have to understand the risks that our caregivers are facing, along with the need to provide care to adults in their community. And so recognizing that restaurants are laying off, that retail places are closing, Uber drivers are no longer having to provide rides to people that are traveling for work. And so how can we utilize that population? That's a population that is already comfortable and familiar with taking care of others, just in a different capacity. Mm-hmm. They're serving others in a restaurant. They're serving others in a retail environment. They're providing support, but in a different way. So how do you take and leverage those folks who are out of work but have been doing something different, and make available to them maybe this new career, or even just a bridge career until they get back on their feet in an industry that they're more familiar with, into providing care for those in their communities? And that's really where we created and worked. Our marketing department is amazing, and really worked to create some promotional ways to get the word out there that, hey, just because you've been doing this and now you might be out of work, here's something else you can do that's going to be just as, if not even more meaningful to you and what you do, in a way to provide for your family, but also provide care to those in your community. So we found success in that. So a lot of different things that we were doing from a recruiting standpoint, but yeah, we had to think outside the box for sure. Mm-hmm.
So we're a couple years in now. Are you guys starting to see some burnout with caregivers?
I would say, and Lanita, please feel free to chime in. Absolutely. Yes. We're seeing burnout. Yeah. We're seeing burnout with caregivers, but we're also seeing burnout with the office staff that are within each of those franchise locations.
Yeah.
We, as an industry, and these folks are called different things across the industry, but most probably commonly referred to as schedulers. Mm-hmm. These are the folks that are scheduling care for the seniors, and they're talking to both. They're talking to the seniors and to the family members of the seniors who need the care, and then they're talking to the caregivers on the other end who are responsible for providing the care. And they're dealing with caregivers who have to call off. And that might be because, again, school's canceled, have to do some things with my kids. My kids are sick. We have to quarantine. I'm experiencing symptoms. It could be any one number of those things. And so that scheduler is really, oh my goodness, that heart that they're working with the clients on who need the care, and they're not able to find people to provide that care, or they're struggling and just dialing for dollars to find a caregiver who can pick up that shift. So yes, we're experiencing burnout from caregivers for sure, for the very obvious reasons that we've talked about. But we're experiencing burnout from those in the office too. And I think they're kind of the silent ones that we don't think about very often, that are really experiencing burnout themselves.
Yeah, I would totally agree.
And would you say most of your folks are actually getting back into the office, or would you be including the people that are doing their office job from home?
Most of the franchisees did not. They sent their staff home, their office staff home at the very beginning. Mm-hmm. But, risking, of course, not having talked to all 600 of the territories, most of those folks, I would say a vast majority, in the 90%, are fully staffed back in the office working. But again, there's protocols there too, that you're masking up every day. There's the social distancing. There's those that are still dealing with child care issues or elder care issues of their own. But for the most part, I would say the franchisees have really worked hard to get those office staff back into the office.
Mm-hmm. Any predictions on how the Great Resignation is going to play out, and the future, the near-term future of the labor pool?
Lanita, I'll take a breath here. I want you to.
She gives you the hard ones, Lanita.
She does.
I do. But if you want to talk about nurses and clinician staff,
sure.
And then I'll answer from another perspective.
I don't think any industry is immune from the Great Resignation. People are looking for, just like every other aspect of the pandemic, it has really changed people's philosophy on what you really want to do. And we, like Nikki said, are not immune to the burnout and the COVID fatigue that we see in every other industry. Nurses being one of the big burnouts that is clearly in the headlines every single day. Obviously, I have a huge network of nurses that would agree that I'm not sure anymore that this is what I want to do. It's just too hard. But I would also say that the network of nurses that we have right at home, and I think through the home care industry as a whole, it's different than working in a facility, and there's less of that burnout. I think it's harder for us just to, when you walk into home care, to understand what home care is versus what we did in the past. But once we've learned that and embraced that, there's so many other things we can do that I would say decreases our burnout that you're seeing out there because of COVID. There's other things, there's always stress in every job and responsibilities that you may decide you don't want at some point in time. But again, people all over the world are relooking at what's my career path and what I want to do. So we certainly are not immune to that.
You're absolutely right. And when it comes to what I would call corporate pieces, outside of the caregiver world, this great resignation is impacting every single company, every single industry, and every single level of professional. We're seeing it at a corporate office level. We're seeing it with our partners, our vendors. This is, what really has happened is the world has become the recruiter's playground. And no longer are recruiters, stuck looking for talent in a specific community where a company is located. They are now able to look all globally, but for sure here in the United States. And that's, looking more and more attractive for folks. So, we talk about unprecedented. I've never in my 20 plus years of doing this have seen a shift in workers like I am seeing right now.
Right.
I think it's easier to say right now that we all know at least one person who's changing job, if not career, simply because they can, because it's available to them now. So we see it. We see it from a corporate support standpoint. Like I said, from our vendors, from our partners, nobody's immune to it. And the word that I use, I'll call it the word of the day, but I feel like it's become the word of the year or the last 2 years, is grace. We all need to provide each other with grace. We need to provide our partners. We need to provide folks in the industry. We all need to have some grace because every single one of us are experiencing some really challenging times, and levels of support have started to suffer. And that's just nature of the beast. So it's time to provide some grace and recognize that we're all going to have to work together to really realize really what the new normal is going to look like over the next 6 to 12 months.
Yeah, sure. It's probably been 2 years of this cloud of anxiety hanging over us. And what we've all been really robbed of is our ability to let some air out of the balloon. The analogy I draw is that I miss the people that were not in my department at the office because no one was there's never any conflict with them. They're just there to shoot the breeze. And,
right.
There's all kinds of people that, that sort of offer that a little bit of stress relief that, if you're working from home for 2 years, you just become someone who's attending Zoom meetings and getting tasks done. And with inflation and, we're at the stage where people can sort of move jobs. Why not get a higher paying job elsewhere if I'm just going to be sitting at home all day in Zoom meetings? So
you're absolutely right. And, I am going to use this as an opportunity to plug one of my opinions. And I recognize that this is just an opinion. But one of the statements that you just made really resonated with me in this regard. And that's, I can do my tasks. I can do my tasks at home. Mm-hmm. What I think we all have to remember is that our jobs and what we do specifically in this industry are more than tasks. And yes, we can do our tasks sitting at home, sitting in front of a computer. But at the end of the day, we are here to serve a greater good. And a lot of times that's going to require a lot more collaboration and networking and teamwork that is going to need to happen in the office. So I really wouldn't be surprised. Again, this is my opinion. I wouldn't be surprised if in the next 12 months we start to see a shift back, because I think folks are going to realize that, yes, I can perform my tasks. And some of those jobs will always be that way. There are millions of jobs that are task driven. Our industry, I don't believe, is one of them.
Culture happens in person.
It happens in person, and collaboration happens in person, and it happens accidentally at the coffee maker in the break room. So, it's more than tasks, and I think someday, I think we'll see a shift coming back to that.
Lenita, as we move more towards a value-based pay world and, especially expedited with COVID, so that virtual visits and telehealth and remote patient monitoring, there's more attention put to it. What are your thoughts on what does the future hold for Right at Home to help deliver better outcomes through some kind of like remote, better outcomes, or what sort of things are you guys working on to try to help improve outcomes?
Well, I'd say we always strive to improve the outcomes for our clients and collaborate with partners to increase those outcomes. We all know technology is changing and advancing at a very rapid pace, unprecedented pace, actually. And we will always be leaning into what that care technology would look like in the home. But to that point, we're involved in several pilots focusing on using technology to complement our care in the home, but keeping in mind, too, that the whole reason that we have an industry is to care for people. So you can't replace the care of a person with another person with a technology, but you can support people with a technology. And as an industry in itself, I think we are really looking to how do we supplement, how do we complement the care that we give people every day, hands-on, with another mechanism. We haven't found the perfect way to do that yet. I know that we won't stop until we do, as an industry, let alone as Right at Home. But in the meantime, we're going to strive to improve outcomes in other ways. For example, for us, we utilize very strong quality care standards, and we reinforce those with our network all the time with a defined scope of services that supports both the personal care services, that's our core, that personal care, companionship, and homemaker services, but also supports our specialized nursing services umbrella that goes more into what type of services we could keep doing for someone that kind of steps over the line a little bit into home health, but staying true to who we are and our core services, just giving that extra support. Maybe that's a little bit of RN delegation, maybe to do medication management, maybe it's I need a nurse in there to help support tube feedings or catheter care. But whatever that is, finding that right mix and doing that in those offices that can do that. And for those offices, we encourage accreditation with a home care body that helps keep those standards consistent and those quality levels high. Mm-hmm. And then our own best practices that we found successful in our Right at Home corporate-owned offices, we share those with our network at every opportunity to keep them front and center.
Yeah. Is this private pay nursing, or do you do any Medicare?
We do not do Medicare. We do some Medicare Advantage. We have a couple of Medicare Advantage contracts. But from a Medicare perspective, what we do for the most part is custodial. It's not reimbursed by CMS. There's really no reason for us in our core to have a CMS certified anything, to be honest. Even some of the nursing services that we support are still considered custodial. They don't sound custodial, and I would tell you any nurse would say that's not how we look at it. But from a CMS perspective, it still remains custodial. They're doing a lot of experimenting. They're working with the Medicare Advantage programs to try to find a way to support us better in the home with those services, which is why we work with some of the Medicare Advantage partners, same with the Medicaid waiver partners. But at our core, we're a private pay company, but we're always embracing and looking for new funding sources to assist our clients as they manage the care in their home.
Yeah. What percentage of the business in the U.S. would be Medicaid?
I don't know that I have a percentage on that. It's not high, I would not say.
But it sounds like you're 2/3 of your business, or 3/4 or even more, is strictly personal care, private pay.
I would agree with that.
Mm-hmm.
Would that be about the same in the other markets that you guys are in? You're mostly personal care, private pay?
Yeah. And I want to give a shout out. I'll take this opportunity to give a shout out to our Director of International Operations, Tony Bucheri, who does a great job supporting our international master licensees, who then in turn support their franchisees in their respective countries. And if you were to ask him, he would say, yeah, the model and the business mix is very, very similar, mirrors really the United States, where it's the companion care, personal care, and then, of course, some of those skilled or higher level nursing services that are offered. Of course, each country, Lenita and I talked about this, each country has their different regulatory bodies and what can be done under each of those kind of scopes of services. But the business model itself is mirrored across all countries.
Sounds like Tony is the international man of home care.
Yes, he is. And he has years and years and years of experience in doing it. He's terrific.
Great. Well, we're almost up on our time here, so I'll get you out of here on this last question. Give us a reason to be optimistic about future of care in the home.
I mean, honestly, I don't know why anyone wouldn't be optimistic about care in the home. This industry has been around now for over 27 years. We've been right up there with the first ones to the market. We have shown over and over again how we can care for someone and really put us in a better place with them. Meaning I want to age where I want to age. And that's what we are designed to do, is to help you age there. Some of the hardest transitions in an adult's life is when they have to make those really hard decisions for their parents and their grandparents. And I've had to make some of those, and they're very painful. And I am so optimistic that we can do more, and the more that we can add in to support people to stay in their homes. I mean, when I look at it as just from myself. It's like, I don't want to, there's a reason that we have long-term care, and I embrace the reasons that we have it, but it's not that just because I'm getting older and I can't do everything for myself that I need to go into a long-term facility. There's so much that can be done to support me in the home, both from my family, from a paid caregiver perspective. And that's what people should really be exploring and embracing to see what really works for me. And that's obviously my clinical type opinion on that. I've been in this industry for almost 10 years now, and that's how I've always felt about it. And when it's my turn, my daughter's very clearly been schooled on where that actually looks like and what we need to do. And I would say that to any other of my loved ones too, for the same reasons. But Nikki, I'll let you see if you have additionals you want to chime in on that one.
Yeah, no, Lenita, I completely agree with you. I don't know why someone wouldn't be optimistic about this industry. We are coming into a time right now from a psychology perspective. We're looking at the next generation of seniors coming in as the baby boomers, and these are folks who have from when they were young. These are individuals who have been independent and who have been able to make decisions for themselves about themselves, and they're very bullish on what they want when they want it. And so we're going to be looking at a generation here that is going to say, no, not so quick. I am not ready to go to a long-term care facility. I love my home. This is where I raised my kids. This is where my family became a family, and I want to stay here for as long as I can. And so therefore, let's have a plan about what that can look like to allow that to happen. And so I think the more conversations that children and grandchildren can have with their parents and grandparents and really creating that plan and understanding their wishes, we're going to see the industry boom. But again, not because it's good for dollars and cents, not because it's good for revenue, but because it's good for our seniors. Because this is what they want when it comes to aging gracefully in place. This is what they're looking for. And it's our responsibility as a community to support them in that endeavor. And baby boomers are the biggest generation that we've got out there. And so we're just going to continue to see this need increase. So next, I think really the next battle is recognizing the caregivers for what the caregivers do, and really elevating that role because of the significance and the importance that they play in this entire piece.
Absolutely.
Yeah, that was really well put. And you're right. There's a place for long-term care, but every research study I've ever seen, it's a necessity, but it's never anyone's choice. You know, the dominant numbers are people obviously want to age in place and die at home.
Mm-hmm.
Well, ladies, this was amazing to learn a little bit more about Right at Home, and nice to meet you both. We will sign off for now, and I want to thank you for being on the show today.
Thank you so much, Jeff.
It has been such a pleasure. Love talking about something we all have such great passion around. Thank you for inviting us.
Yeah, absolutely.
Home Health 360 is presented by AlayaCare. First off, I want to thank our amazing guests and listeners. To get more episodes, you can go to alayacare.com/Home Health 360. That's spelled Home Health 360, or search Home Health 360 on any of your favorite podcasting platforms. The easiest way to stay up to date on our new shows is to subscribe on Apple Podcasts, Spotify, or wherever you get your podcasts. We also have a newsletter you can sign up for on alayacare.com/Home Health 360 to get alerts for new shows and more valuable content from AlayaCare right into your inbox. Thanks for listening, and we'll see you next time.